ABCDE Assessment. A BCDE approach is a systematic approach to the immediate assessment and treatment of critically ill or injured patients, focuses on the most life-threatening clinical problems, provides life-saving treatment, most critical intervention first, manages the problem before moving on to next step. The initial assessment and treatment are performed simultaneously and continuously, helps to rapidly recognize the need for assistance. It involves working through the following steps: airway, breathing, circulation, and disability exposure. ABCDE Approach 1. Gather history critical for management of the patient. 2. Safety is the scene safe to approach. Scene safety, use PPE. 3. Introduce yourself to the patient, including your name and role. 4. Start ABCDE assessment. Airway, can the patient talk? Yes. If the patient can talk, the airway is patent. No. 1. Look for signs of airway compromise. These include cyanosis, seesaw breathing, use of accessory muscles, diminished breath sounds, and added sounds. 2. Open the mouth and inspect. Look for anything obstructing the airway, such as secretions or a foreign object. Intervention. Call for expert help. Basic airway maneuvers to help maintain the airway using a head tilt, chin lift maneuver, jaw thrust. If an obstruction is visible within the airway, suction to remove it. Insert oropharyngeal airway or nasopharyngeal airway or supraglottic airway to keep airway open. Breathing. Review the patient's respiratory rate. Review the patient's oxygen saturation. SPO2. Inspection. Signs of cyanosis. Cough, stridor, shortness of breath, lips and tongue swelling. Palpation, tracheal position. The trachea deviates away from tension, pneumothorax, and large pleural effusions, and deviates towards lobar collapse and pneumonectomy. Chest expansion, symmetrical or asymmetrical percussion. Normal should be resonance. Dullness, hyperresonance are abnormal finding. Auscultation. Abnormal findings: reduced breath sounds, wheezes, fine and coarse crackle. Intervention. Administer high-flow oxygen treatment according to the problem, e.g., acute asthma, nebulizers, steroids, magnesium sulfate, tension, pneumothorax, needle decompression. Anaphylaxis management with adrenaline IM. Circulation. Assess the peripheral perfusion, warm or cold, clammy. Assess the patient's radial L pulse to assess rate, rhythm, volume, and character. Insert big gauze IV cannula and send blood samples as required. Do venous blood gas. Check blood pressure. Attach to 3-lead ECG. Check capillary refill time. Intervention. Hypovolemia. Fluid resuscitation. Fluid overload. Diuretics. Hemorrhagic shock. Blood transfusion. Acute coronary syndrome. Morphine, oxygen, nitrates, aspirin. Sepsis. Follow sepsis bundle, bradycardia, or tachycardia management accordingly. Disability. Assess the patient's level of consciousness using the AVPU scale. Alert. The patient is fully alert, although not necessarily orientated. Verbal. The patient makes some kind of response when you talk to them. For example, words grunt. Pain. The patient responds to a painful stimulus. For example, supraorbital pressure. Unresponsive. The patient does not show evidence of any eye, voice, or motor responses to pain. Assess the patient's pupils' size, symmetry, response to light. Assess the motor power of all limbs. Check glucose. Intervention. Maintain patent airway, hypoglycemia management, diabetic ketoacidosis management, CT head if needed. Drug toxicity. Antidote accordingly. Exposure. Inspect the patient's skin for evidence of rashes, for example, adverse drug reaction, meningococcal sepsis, bruising, for example, coagulation disorders, trauma, surgery, and signs of infection, for example, cellulitis, and edema. Review any surgical wounds for evidence of hematoma, active bleeding, or infection, for example, purulent discharge. Review the output of any surgical drains for blood loss, fluid loss, signs of infection. Assess for DVT, check body temperature. Intervention. Bleeding source control, blood transfusion, infection, sepsis bundle, hypothermia warming, DVT anticoagulation. Reassessment. Reassess the patient to identify any changes in their clinical condition and assess the effectiveness of your previous interventions. Seek help if any concerns. Thank you For more nursing-related videos, please subscribe, like, and press bell icon.